All right, so a little bit of background about this patient case. It's a 48-year-old female who is unemployed. She lives with her family, which includes her mother, father, husband, 15-year-old daughter, and 18-year-old son. Her father has a diagnosis of Alzheimer's disease, and her husband works full-time to support the family. She and her husband immigrated from Mexico to the United States about 20 years ago. She has several extended family members that live in her neighborhood. However, she has had a recent disagreement with a cousin regarding a legal dispute. The police have visited her home on 2 occasions to question her. She has started limiting her contact with her extended family because of this dispute. She has become more irritable with her children when caring for her parents. She worries that the police are going to, again, come to her home to question her. And because of this, she keeps the blinds shut and occasionally looks out the window to determine if police are in her neighborhood. She occasionally has to take breaks from her housework because she feels like crying, and she does this in her room away from other family members. Her housework tires her out, and some days she does not feel like she can complete all the tasks that she would like to do. She feels distracted from her work by her worries. She also worries at night, which makes it difficult to fall asleep. She will often lay in bed throughout the night, but feels she only gets 3 or 4 hours of sleep. Sometimes she notices a tingling sensation in her hands and feet, feels hot, and feels sick to her stomach. These feelings eventually pass after about 30 minutes. She has not discussed her feelings with her family because she is the caretaker, and she doesn't want to burden them with her worries. Her children have noticed that she is not getting their laundry done in a timely fashion. She no longer wants to spend time with other people. She has had stomach upset, and she is not eating as much as she usually does. Actually, the opposite. She's found that she's eating more than she typically does. She has had thoughts that it would be easier if she was no longer alive, however, no active suicidal ideation. She is Christian and feels that suicide is a sin. She does not drink alcohol, smoke cigarettes, or use other illicit substances. She does drink about 1 liter of regular Coke per day.
Well, thank you for coming in. I'm Dr. Lewis, and we're going to do an initial interview to see how you've been feeling. Now, I would like to understand the problems that bring you here so that I can help you more effectively. I want to know about your experience and ideas, and I'll ask some questions about what is going on and how you're dealing with it. Is that okay?
Yes.
What brings you here today?
Well, I can't sleep, and also I am worried too much. And I cannot do everything I have to do at home. So I'm concerned about those things.
Yes, they do sound concerning. People often understand their problems in their own way, which may be similar or different from how doctors understand them. How would how doctors describe the problem? How would you describe your problem?
Well, I got in this argument with my cousin, and I feel like everybody's against me, and my family who lives around, they believe that it's my fault what happened, and I cannot trust my family right now because of that, and I feel like I did something wrong, and also I think he's not fair because he calls the police, he get involved the police, and that's not good. I mean, we don't do that. I mean, family can't just call the police on you, and I really worry about that. I don't want the police to come at my home or anything like that. I'm scared about that.
It sounds like you're really worried.
Yeah, because there is a lot of things involved, the fact that, well, I know that everything I am going to say to you is going to be confidential, but I want to be sure because there is a lot I can risk here, and I don't want to risk my family in this situation.
No, I'm glad you're raising that point. Everything you say here is confidential.
Okay.
The only things that I would be concerned about in terms of not being confidential is if you tell me that you're going to hurt somebody, or possibly if you tell me that you're going to try to kill yourself. Those are the two areas where I may have to do something about it. But other than that, other things are confidential.
Okay. Well, the thing is that because my cousin called the police, they have been twice in my home, and they are making a lot of questions to us, and because what happened between me and my cousin, and now I'm really afraid that the police came again. And then if they say that we have to go to the police station, we have a lot to risk because we are undocumented here, and we have been here for 20 years, and we just cannot afford to come back, and a lot of things are going on right now, so I feel like I have a lot of anxiety about that thinking, and I worry too much, and I cannot sleep, and I just sleep for 3 or 4 hours, and I am awake, and I have to, and thinking, and my husband says that this is because the stress, and I feel stressed for all these things. I mean, I don't want to be deported. I don't want to risk my family, my children born here, and if we go back, I mean, I don't have anything there. Right now, my 3 years ago, my parents came to the United States, and my father is really ill. I have to take care of him. My mother is really old, and there is too many things going on.
Yes, it sure sounds like there's a lot of things that you worry about. When you talk about this with your husband, for example, how do you describe your problem to him?
Well, I told him that this is not fair what is happening between me and my cousin, and he agrees with me, and I told him that I'm thinking about this all the time, and I am really afraid of the police, and I'm afraid that they are going to discover what is going on. I mean, the fact that we don't have papers. And then, I mean, they can really get us deported.
Yes.
And my children are going to be here by themselves. And what about my parents?
Correct me if I'm wrong. It sounds like the part of the situation that most troubles you is your worry about being deported. Is that right, or does something else trouble you even more?
Well, that's one of the main things, but also I'm really concerned about the situation with my family. I mean, we cannot afford being against each other. I mean, for me, it's really important that we can be a good family, and we can support each other. And the fact that I am not talking right now with my family because of this is... it's driving me crazy. I cannot sleep. I know this is probably something that you don't understand, but I had to have this contact with my family and talk with them and go to the different gatherings every Sunday. For instance, right now we are not together because we are not talking. So that's another thing that is really important to me. And also my children, I mean, I have to keep them at home all the time, and they are not happy about that. They are teenagers, I one day go to my cousin's home and, have this unity again where we can support each other. I need also his opinions about many things. I mean, it's the way we used to, so
Right.
it's kind of hard for me right now.
So those two things, it sounds like you're saying there's at least two big things that are a problem. One is the fear that the police will come back. You're worried about that, and that'll end up in deportation and breaking up the family that way, and everything that would mean to your parents' health and everything. And then the second thing is the fact that there is this conflict in your family where people that used to get along quite well and were very important to each other are now divided. And those two things are really, really bothering you, making you not being able to sleep and so on. Do I have that right?
Yes, you are right. And also the fact that back in my country, I mean, because we are fighting, my family is divided, you know. Some members of my family believe that he is right, and
I see.
And no, we cannot do that.
Right, it's splitting the whole family, even back in the old country.
Yeah, because I have to talk with them, and her mom used to talk to me a lot by phone, and now she's not talking to me. And that makes me feel really sad. And also, I can't do my chores. Like every day I have to cook and do laundry and do several things. And I cannot do that. I mean, my family, my children are always demanding things, and I feel like I am not doing what I am supposed to do, you know? I'm not working right now, and then I have to take care of my family, and sometimes I can't cook. I just feel so tired, and I have to be there on bed, and I feel like I'm crying all the time, and I cannot do that in front of my parents. They are really old, and my children are asking me, where is this, where is that, and I feel like I'm not doing what I am supposed to do. I'm not a good mother right now, or a good wife, or a good daughter either.
Yeah, it sounds like this family situation has produced all sorts of problems in the way you feel, in the relationship with your family overall, in the relationship with your family here, family in Mexico. I mean, it's really, what would you say has caused this family division? What is the problem that has led up to it, and the way then you feel about it?
Well, a lot. I mean, just for a legal dispute, I mean, we cannot break in that way and then risk everything, you know. And the worst thing is getting the police involved and breaking the family apart.
Yeah, right. He did the wrong thing by doing that.
Yeah. I mean, we cannot do this. He is undocumented also. We cannot afford to do this.
Yeah. Yeah. You know, some people explain their situation, their problem, as the result of bad things that happen in their life, and other people about problems with others, or a physical illness, or a spiritual reason, or so many other things. You know, what do you think has caused this problem overall?
Well, I'm passing for this period of really bad luck. You know? But this is the thing that I really don't understand. I cannot trust my family right now because of this. And I feel like everything is falling apart right now because of the police involvement.
Yeah.
And our family is divided.
Yeah, and that your cousin has in some way put his interests above the family's interests by calling the police.
It's actually, that's what is happening right now.
Yeah, and you say that some of this is bad luck. How do you mean?
Well, you know, fears the fact that I'm not working. Since 3 years ago, I cannot work because my parents came to the States, so I have to take care of them.
Right.
So somebody in the family, even if I have 4 sisters back in Mexico, I mean, they cannot afford to take care of them. So I'm the oldest, I'm supposed to take care of them.
I see.
So I told them, well, came to the States.
Right, that's the only way you can do it is if they came here.
Yeah. So is one thing to another, you know.
Did the bad luck start then, or did it start now? When did the bad luck start?
Well, right now with my cousin,
Before that, it was okay.
kind of. I know it's my obligation to take care of my parents. I know
see.
that, but my dad is like a little child right now. You know,
He's really sick.
he reacts like a little boy, and I have to do everything for him. Unfortunately, my mother cannot do anything right now because she's really old. She hardly can move right now. And
I see. She's not in good health either.
she has diabetes.
I see. So you have a lot of things that are on top of you, a lot of weight to carry, if you will.
Yes. Yeah.
And you've been able to carry it, but then this situation kind of pushed it over, a little bit too far.
That's true.
Right. Now, what do other people in your family or friends or others in your community think might be causing this conflict that you're having with your cousin and all the things that came after it?
Well, I think my husband thinks it's the stress, and he thinks, my cousin is not a good person right now. But I really cannot talk with my family about this. I talk sometimes with my sisters back in Mexico, and they think I am right, but I know the another part of my family is saying that I'm wrong with
I
this.
see.
And
They take his side more, is that?
yes,
I see.
yes, especially, his mom, and I understand that, but they have to understand also that we help him come into this country.
Right.
And also, I don't know, I just don't want to go out.
Yeah, I wanted to ask you about that because I'm wondering, now that we're talking about causes for a moment, what caused things, I'm wondering if the situation that happened with your cousin and the fact that he put his interests first over the families and the way that's affected you, whether your reaction was caused by anything else other than that he did. Was there anything else that caused your strong reaction to it?
The fact that he calls the police.
I see. That's really the thing.
Yes, that's really the thing, and the thing that he brought the family.
Yeah, right. That's the real reason why you're this way. Okay. And it sounds like your husband and your sisters agree with you, but not everybody agrees with you. Yeah.
Yes.
Now, are there any kind of supports that make this situation better, such as supports from some members of your family or friends or others?
Well, it helps to talk with my sisters by phone, but it's not the same like if I can talk with them in person. Also, I was participating in this support group with all these women from the community, but I don't feel like I'm going there anymore because they know what's going on, And I know that another thing that really helps me in the past was to talk with a therapist. Just the fact that she was there and she was a good listener, that helps me. That's why I decided to come.
I see. So you had that good experience with a therapist before.
I did.
Yeah. I'm going to ask you about that in a couple of minutes, about the therapist.
Okay.
Now, so it sounds like talking with your sisters really helps, and the support group helped, but then the support group didn't help anymore.
No, definitely I'm not going to be back there because everybody wants to know what's going on, and no, I don't want anybody knows about
They're
this.
kind of nosy, is it?
Yeah, they are, yeah.
And it's hard to trust them, it sounds like. Yeah. Now, are there particular things that make it worse? Like, I understand that your conflict with your cousin, the fight with your cousin, that really has made it worse. Is there anything else that makes it worse in terms of difficulties with money or difficulties with other family problems or other things?
Yeah, I mean, the fact that we have a lot of debts right now. I mean, since my parents are here.
And you're not working.
Yes, and also, I mean, one of my sisters and her children depends on us. We are
The ones in Mexico?
yes.
Yeah, you're sending money there. Sure.
Back, yeah. But right now, because I'm not working, I cannot afford to help them, and there is too many tensions, So that's another fact also.
Yeah.
But the real thing is the fact that I'm really scared about the police.
Yes, I was going to say, yeah.
Because if they come, I know, I mean, before I haven't had any problems, But now I don't want to drive, and I have to drive my father to everywhere because he has many appointments, and I cannot afford it because I don't have a driver license.
Right.
And if they know, they are going to put me immediately in jail, and they are going to see in my record that I am not.
Right. Yeah, documented. Yeah.
Papers. Yeah.
Yeah. So that fact is an enormous difficulty for you.
That makes me awake the whole time.
But it sounds like before you were able to handle that okay, but after this involvement of the police, that's really hard.
Yeah, because I've been here for 20 years, and I'm a good driver, I haven't had an accident or even a ticket.
Mm-hmm.
Even a ticket. I mean, I'm good on that.
Mm-hmm.
But now that I know that if I got a ticket for something, it's going to be really bad in my situation. In our situation, it's not just me.
Yes, that's right.
All my family.
The whole family depends on you.
Yeah, kind of. And I am not doing my duties, I know.
Yeah, that really bothers you. I get that part. Now, I'm going to switch a little bit and ask you about something else, okay? Sometimes aspects of people's background or identity can make their problem better or worse. Like in this case, it could make the feelings that you have about this fight with your cousin make them better or worse. And by background or identity, I mean, for example, the communities you belong to, the languages you speak, where you or your family are from, your race or ethnic background, your gender or sexual orientation, and your faith or religion. These are all parts of background or identity that I'm talking about. Now, for you, what do you think are the most important aspects of your background or identity?
For me, it's really important that the unity of my family,
yes.
And not get involved with the police for the risk. And also, as a mother, I have a responsibility, and I have to take care of my children, and I am not doing that right now because I cannot sleep. I feel really tired all the time. I'm not sleeping. I'm eating too much. I'm really concerned about what's going on, and that doesn't allow me also to take care of my parents. And to be honest with you, I'm not really a good wife either. I just want to lie on bed and forget about every single thing. And also the fact that I am not allowed to be outside right now and doesn't have the opportunity to talk with these women that were kind of support me for a long time right now.
Which women are we talking about?
With my support group.
I see.
And with my family also. And it's the only time when we can really speak our language. I mean, I speak Spanish all the time at home. But it feels like I belong to some group when I have that opportunity, you know, and I like to cook for my family and being there.
Yeah. It sounds like in the past, when things were good in your family, then these women were really helpful and it was a real good place to go. But now that there's been this division in your family, you can't really trust them so well, and that's one thing that you really miss.
Yes. I miss that, but at the same time, I don't want to be out. I mean, I don't
Yeah.
feel like I don't
Yeah.
have the energy to do the
Right.
things that I used to do and cook for this group or for my family.
Right. And it sounds like parts, from what you've said, parts of your background and identity that have been affected, that are affecting your situation with your family and the feelings you have about it. There are a number of them. The fact that you're undocumented is affecting it. Your role as a mother and as a wife are, your concerns about that are affecting it. The relationship you have with your family, the importance of your family in your life. These are all aspects of things that are really connected to how you feel about this problem.
And also the fact that every Sunday we go to church.
I see. Uh-huh.
And my husband has been suggested that I have to talk with my priest, but I'm not going to do that because my cousin is talking with him too.
I see.
So I don't know even what how to explain things to him.
I think in some ways this difficulty with your cousin has made it really hard to know who to trust. You're sure of your husband and of some of your sisters, but it's hard to be sure of other people.
That's true, yeah.
Oh, that's hard. Now, are there any other aspects of your background or identity that are causing other concerns or difficulties for you?
Yeah, well, I don't want to be back to my country
Right.
Nothing,
Yeah, you came here to build something.
Exactly, yeah. I came here to have a better life and, got a better job and help them. And I cannot just go back and say, I'm here without nothing because they deport me.
Yeah.
And plus, they deport me because our cousin was
Yeah,
talking.
yeah, right. Yeah, it'd be a double problem. You not only would be deported, but you're deported because your family didn't back you up, in a sense.
Yeah, and because my family is really important to me, I don't want that happens. Yeah.
I guess it would also affect the family in Mexico if that happened.
That's correct.
Now, sometimes people have different ways of dealing with problems like this situation with your cousin and the feelings it's provoked. Now, what have you done on your own to cope with this problem?
I don't know. I think that I'm not enjoying anything really right now, but I'm just there crying. I mean, I hide myself in my room to cry, and I'm just worried too much. And like I say, I have to eat a lot in order to cope with this, I mean, I feel really anxious, like I have to eat all the time. And
I see.
I know I'm eating too much, and that's not good for my health. I know that.
But it sounds like it helps a little bit in the moment. You feel
yeah.
a little better.
Oh, yeah, definitely. I don't know, I forgot for a little while what's going on, you know.
And it sounds like you also go to church, even though it's hard to talk to the priest.
Yes. Yeah, I feel some comfort going there, but lately I don't want. I mean, even I don't want to go to church anymore because I know I'm going to see other relatives there.
Yeah.
And the situation with my cousin, he's going to be there. But
Yeah, I could see that. It's a even that is being affected by
I feel like
the situation.
Sometimes that helps too.
Mm-hmm. So that's a source of support for you too, your faith.
Yeah, and talking with my sisters back in Mexico, I mean, that helps me too.
Good. Okay, so there's a few things that you do. Talking with your sisters, your relationship with God, even sometimes going to church, eating, though it has a problem with it, it's sometimes helpful.
Yeah.
Now, often people look for help from different sources. We've talked about some of them already, including different kinds of doctors, helpers, or healers. Now, in the past, what kinds of treatment, help, advice, or healing have you sought for this set of worries you have about your cousin and the family? Like, it sounds like church is one of them, but the priest not quite. And it sounds like you went to a therapist at one point, and your support group is another. You've said a number of these. I just want to make sure I know what what have you tried to do?
Well, in the past, like I say, it helps a lot to talk with, because I have similar problem in the past. I was kind of really sad, and it helps to talk with with a therapist. And also talking with my priest helped a little bit. But now because the situation is different and the police is involved, I mean, that's not.
It's not as good.
No.
Now, in the past you went to this therapist. Could you tell me a little bit more about that?
Well, I mean, it was good because she was there for me, you know, and she was a good listener, and I can tell her everything that was going on in my family, and I knew it that she's not going to say anything.
Mm-hmm.
So that helps me.
So it's possible to trust her.
Yeah, because, yeah.
I guess it's hard these days to know who to trust with somebody so close like a cousin having done something you really didn't expect them to do. That's so wrong in some ways for them to do, like go to the police.
Exactly.
Yeah. Now, what do you think, what kind of help or treatment do you think was the most useful thing for you?
Well, I mean, the fact that she was there for 45 minutes and just she was listening and, you know, she was trying to help me and I knew it that I can trust her. She's not going to be around in the community telling people what's going on in my life, you know.
Mm-hmm.
That helps me a lot.
I'm glad that was very helpful. What do you think was not useful of the things that you've tried in the past?
Well, I feel like because at that time I have insurance. That was good because we have like I can't remember like probably my insurance approved some more visiting with her, but was just for a period, and then I have to cut that. But by the time when we started to let it go, I feel really better. Yeah, but that wasn't useful. The fact of they say you have just 12 visits or something like
Right.
that. Even if, I mean, she was looking for something else, and we got it, but.
Yeah, it sounds like the limitations with the insurance was not a useful part of things. Now that actually gets to my next question, which is that whether anything has prevented you from getting the help that you need.
Well, yeah, I mean, right now the insurance of my husband is real limited, and
Yeah.
also I don't have time to make appointments for me.
Yeah.
I have to take care of my father, and you know, do the things at my home and all. I don't have time to make a lot of appointments for me. So, and I'm concerned when I have to drive. I mean, I almost feel like they are looking for me, you know, and they are going to come anytime.
Do you feel they're actually looking for you? Or is it more that you're afraid if they come across you, they'll be in trouble?
Yes, it's more that. But I always am peeking on by the window because I shut up all the windows, but I am looking and see if they are in the neighborhood, you know. And I don't want they come again and make me more questions. I mean.
Right. No, this police thing has really been awful for you. I mean, it's really made you feel terrible.
Yeah, really, yeah.
Yeah. Now, I just have a few more questions, and then if you have any questions for me.
Sure.
Now I wanted to talk more about the help that you need now.
Mm-hmm.
And in general, what kinds of help do you think would be most useful to you at this time for the amount of worry and all the feelings you've had as a result of this conflict with your family?
Well, I don't know. I mean, I want to be here, and I want to be somebody. I want to be with somebody. Like I feel like I can talk and say everything about my fears, you know.
Mm-hmm.
And that I know that is going to help me. And also, I know you cannot do this, but I wish you can talk with my cousin or somebody else. Talk with my cousin and tell him that we cannot afford to do what is going on. And I don't know, in another way, I feel like I need to sleep. I need to do something about that. So I don't know if I don't want to, but probably some medicine to sleep. But I don't want to. Then I don't know if I'm going to use to that. I have another family member who was taking this medicine to sleep, and now she cannot just leave that, and I don't want that happens to me. But I think that probably, I don't know.
You're afraid that if you start taking a medicine, you wouldn't be able to sleep without it. Is that?
Yeah, yeah. But
So,
you are the doctor, so you can tell me.
Well, sure. I'm the doctor, and we can talk about that. But you're the person who would be taking it, so your experience is really important to me, because if I don't know what you think about it, then I could offer you things that may not be right for you. Now, it sounds like you really have hope that by talking, a couple of things would happen. One is that you would maybe desahogarse, is that right? Sort of like,
Yeah, yeah.
That you would unburden yourself of this problem.
Yes, yeah.
And also you're even hopeful that communication is still possible with your cousin, that somehow if that communication could happen somehow, and you're hoping that somebody could help you with it, but if that communication could happen, then things could be resolved.
Yes, yes.
Yeah. What has gotten in the way of communication with your cousin?
We are not talking right now.
You're really mad at each other?
Yeah. But I think he, I mean, the fact that he called the police, that tells me everything,
Yeah, that's kind of a line that he crossed, if you will, huh? Would you say it's a falta de respeto?
Yeah, I think so.
I see.
It's out of respect. It's out of respect for me, who has been helping him for a lot of time. It's a lack of respect with the entirely family, with my parents who are here.
That's right.
He has to respect my parents.
Yes. They're his uncles. Is that how it is?
Yes. Our mothers are sisters.
I see.
So that fact.
Yeah.
Yeah, and he's not coming to home to talk with my parents anymore, and his family is not coming either. His children are not coming, so my parents, of course, are upset and wonder what's going on, and I'm trying to keep everything, like nothing is happening, because they are really old, and I don't want just concern them anymore.
Sounds like he's been sort of offending people by his behavior. He's done an offending thing.
Yes. Yes.
Yeah.
Definitely, I feel that way. Yes.
And then there's all these. So there's the idea that by talking you would feel better. There's the idea about communicating better with your family, and there's also these questions about whether taking some kind of medicine would be helpful for how you feel, but you're concerned that they would be addictive in some way, or maybe that you, even if they worked, you wouldn't be able to function without them, that you would have to depend on them in order to function.
Yeah, and then there is another fact. The police is going to say probably that I'm drug addict.
Oh, I see, on top of it, right. Use it as a reason against you.
Yes, they can use things like that against you, I know that.
I could see that that's a concern, and it's something that we can continue to talk about for sure. Now, are there any other kinds of help that your family, your friends, or other people in the community think would be helpful for you, for this, how you're feeling about your situation with your family?
Well, like I say, my husband thinks that I should talk with
to the priest. Right.
And also, he thinks that probably I can talk with my parents and tell them, and then they can talk with my cousin.
I see. Right.
I don't know. I don't want to do that right now.
Why is that a bad idea? Tell me why that wouldn't work well.
Well, it's not a bad idea because I know in the past my cousin here to my
Yeah.
parents because they are older.
Yeah, he respects them.
Yes, but now because they are really old and they have too many things to be concerned about. I mean, they hardly are out of the home and things like that. And I don't know. I don't want to add something else.
Yeah, you'd be burdening them in some way.
Yes,
You're afraid.
yes.
I see.
And a good daughter doesn't do that.
I see.
I mean, they are really old.
Right. Yeah, that's an important part of how you understand your situation, your relationship with them. You know, you should help them. You should, prevent them from having more problems than they
Yes,
already have.
yes.
Yeah, rather than ask for help from them.
Mm-hmm.
Now, my last question for this part of the interview has to do with, this topic, which is that sometimes doctors and patients misunderstand each other because they come from different backgrounds or they have different expectations. And I'm wondering, have you been concerned about that in coming here? And is there anything that we can do to provide you with the care that you need?
Well, to be honest with you, I was hesitating to come because first for the time, but I didn't know if everything that I say is going to be
Yes,
confidential.
confidential.
In the past, it was confidential, but I don't know if the rules change or something
Sure,
like that.
sure.
And also, I mean, I was expecting to talk with a woman,
Uh-huh.
but I mean, I'm okay now with you. I mean, there is nothing. And also, I didn't know because nobody here speaks my language. And it's okay with me. I can talk in English, but I was hoping to have somebody who can speak the same language.
Yeah.
It's true.
How would it be different if you spoke with somebody who spoke your language as opposed to somebody who doesn't?
I think I don't have to look for the exact words in English, you know.
Uh-huh.
I have been here for 20 years, but unfortunately, I because I was working for too long, I didn't have the time to go to the school. So I learned to speak here, just talking with people around. But it has been difficult, so I feel like if I had the opportunity to talk with somebody in my own language, it should be much better. But now I'm comfortable with you. But I know there are not doctors in this area who speak Spanish.
Yeah,
Or
it's
the
hard,
only
isn't it?
one who speaks Spanish, I mean, he knows everybody
I
in
see.
the community.
Right,
And
right.
everybody goes to his practice, so I don't want to be there.
Yeah. It sounds like one of the things that has happened because of this conflict with somebody as important in your life as your cousin and the repercussion for the whole family, something that has happened is that it's hard to know who to trust. And so it seems to me that you're looking for somebody that you can trust, somebody who will keep things confidential, somebody who will understand, either because they're a woman and or because they speak Spanish or know about people who come from Mexico. I mean, that you're really looking for a place where you can feel comfortable and trust somebody so you can talk about these important things.
Yeah, but now I feel okay talking with you because I know you are listening to me and you are not going to tell anybody what's going on here. And also the fact that finally I came and had the opportunity to talk. That helps.
Good. You feel a little better, like you've unburdened yourself a little bit, desahogarse a little bit?
Yes.
Oh,
yes.
that's good. I'm glad that the interview did that.
Yeah.
Okay, good. Then at this point, what we would do is we would switch to the questions about the symptoms that we haven't really covered much at all. But this gave me I'm switching out of the. Yeah, this gave me a little, a lot of information about what's going on that I would then want to hone in on. For example, I'd want to know much more about depression, for example, and anxiety. And I'd want to make sure there's no suicidal ideation or behavior that we didn't get a chance to cover. And there's a couple of possibilities that we haven't addressed very much that relate to the anxiety component and to the lack of trust component that were questions for me from the interview that have to do with the extent of anxiety. I mean, there's a fair amount of worry, and so I want to know more about possible physical symptoms of anxiety or panic attacks or anything like that, anything in the anxiety field. And there was also the possibility, knowing this population that didn't come up very much so far, but of any somatic symptom kind of issues, just how much does the anxiety lead to any kind of physical problems. And then the issue about possible paranoia, just how far does the lack of trust go, because something as important as a very close family member that relationship has been threatened, then she's watching out for police cars. There is a good reason why she's watching out for police cars, which you added to the material that was originally, that was implied in the material. I think it was implied. It wasn't stated that she was undocumented, I think. I don't remember. But anyway, you really expanded on that side, which gives a very good reason why she's looking out for police cars. But I would want to know, because it is actually, she might be looking because she's undocumented, or she might be looking because this has pushed her in a more paranoid direction than than we might expect, and we would just want to know.
Or probably I'm paranoid because I have good reason.
Yes, no, that's the point. Yes, no, that's the point. That exactly, and that is the point I'm trying to make. It's exactly that one, because the issue is that on the one hand, there's this under-culturalization and over-culturalization sort of problem that you might say, oh, I know why she's looking out for police cars. Wouldn't anybody who was undocumented look out for police cars? Maybe, and that's what, in some cases, yes. In fact, that's the sum total of the experience. She's worried about being deported, and so she's looking out for police cars, and that's it. But if you assume that that's it without finding out, then you'll miss possibly some people who have actually been pushed over into frank paranoia by virtue of this originally very good reason. But it went farther than might be necessary, if you will, and making that distinction can be quite hard, but it's worth pursuing to see if it's anywhere there. So far, that's where I was going with that question of, it was a leading question, really. I would probably reframe it, but the question of, are you just watching because you're afraid to be, because they're looking for you, or are you watching because they might just be prowling the neighborhood, and you said, oh no, they're just prowling the neighborhood type of thing, and so they weren't, you, because they know, and everybody knows, and the Martians know that I'm, undocumented, It's unlikely, but you want to know. So I don't know, should we stop at open, and great. You were great. Thank you very much.
Thank you.
I was struck that you assiduously avoided asking about the specific interaction.
I did.
That was a decision on your part.
Yes.
Can you talk about that a bit?
Yes. It's a good point, and I tend to do that. I'm not quite sure why I tend to do that. Sometimes it's because it's the front door of the castle, and if it's the most defended part of the castle, and if I show too much interest in the most defended problem, it can unleash all sorts of problems. And at times I hope to get at it when she sort of says, but you haven't asked me about my problem. And then she's in a position of wanting to tell me. But if too much time went on, and it may be later in the interview, even in the same interview, the same end, after I do more questioning on more sensitive topics, I might say, what was that thing? I never asked. And at that point, the feelings are gone. It doesn't lead to I don't want this to be a re-traumatizing experience. It's not a re-traumatizing therapy, situation where you want to prepare for it, uncover it, then deal with it. I deal with it that way. On the other hand, I know there's a different way to, meaning there's a different way to deal with it, which is much more what's going on, unburden yourself, sort of wholly, tell me the whole story at the beginning. I tend not to do that. And frankly, I don't know which is better. Different things work for different people really well, and this one hasn't worked badly for me, but I'm curious about whether you guys would do it differently. I don't know how maybe I should ask you first. How was that experience of not asking you about the exact detail? In some ways, they don't matter to a certain extent, but in some ways they could really matter, and I'm not asking. But how was it that I never ask, what did you fight with your cousin about?
I think I feel okay because I didn't want to talk really about the cause of the dispute.
Yeah.
And I feel like you were asking me things that I want to say it. I really want to tell somebody what's going on in my life and my fear with being deported. And that was really good for me. I feel like a relief to finally tell somebody, yes, this is happening in my life, and I am fear for this and these things. So I feel really
It didn't feel like a big mystery, like a gap that I didn't know about that.
You asked a couple of questions about that, but you didn't ask me exactly what happened. And for me, personally, works good.
Yeah.
I feel relieved at that moment to have somebody who can, just somebody who were listening to me.
One thing that often has happened to me, because I work with, this has been doing this for 25 years or whatever, just this population mostly, is that often when I ask some people, say, I don't want to talk about that. And you've sort of reached a point where you can easily come back from it. I understand, it's not a problem. But in some ways I ask myself, why do I care? What does it matter what they thought about, in a certain point? But obviously there's so I guess the bottom line is I need to feel I need to know, and at the moment when I need to know is when I need to ask. I guess that's how and I prefer if they say you know what really happened, because that is when there's trust established, and I haven't cared to a certain extent because it's not why they're here to a certain extent. Then it comes out without great pain. What really happened is, it's very embarrassing to tell you, doctor, but he had an affair with my sister, or whatever. And I told her he couldn't have that affair, and he wants to have it anyway, and nobody can know. And I didn't want to tell anybody, but now that you didn't ask, I'm going to tell you. It's something like that. But I know I guess I'm going on about it because I know it could. I'm happy you picked it up. It's actually a tension in what I do. Yeah.
Related, an area that wasn't pursued in detail, and I can imagine myself in the chair saying, do I want to know more about this? Do I not want to know more about it? It's possible that the frame for the fear of the police is that 3 family members and 2 acquaintances in the last 3 months have been picked up and
Yes.
It's a very immediate assessment.
Yes.
It's possible that I know it happens, but it's never happened to us. It's really not happened to anybody in our neighborhood. I'd be ashamed if I was the first one that it happened to, but it's a much more distant thing. And so how do you think about whether you want to know more about that set of issues?
You guys are asking excellent. I'm really glad you're asking. These are very good questions. Because they're making me think about what I usually do and don't do. And like I say, I was hampered by doing this in English. So there's a sense in which I think you noticed I did this on purpose at the end, that I introduced a few things that I would have introduced earlier, and you saw the change in some way. There was not that you weren't always at different points resonating, but you resonated, it seemed to me, much more when certain things started being talked about. And part of my reticence in knowing these things is that I think, some of them are bad habits. I don't know. It'd be good to rethink them or think them, at times, like now. There's a line as to what is respectful to ask, and it's sort of like part of how I elicit is by not asking. I don't need to know. I'm here for what you want to tell me. And so, if I really ask about the police and the cousin, and you might ask, why does he need to know that? what's it to him whether relatives of mine have been deported or not? You know, or what's it to him about what my problem with a cousin was about? Especially because we live in the same city to a certain extent. At least we're geographically in the same clinic building. You know, the same way she doesn't want to talk to the priest because the priest talks to everybody. Then maybe she doesn't want to talk to me because I want to know too much. You know, and so that's the line. I don't go anywhere. But you know, but that's me. You know, that's how I do it. And so but there comes a point where normally where after 3, 4, whatever number of sessions, they essentially start to trust. Trust is always with everybody a big deal. It's a particularly big deal in Latino communities, you know. And so there you want to establish trustworthiness, you know. Anyway, then I'll.
When you asked her, you know, what she thought would be helpful, and she said, well, maybe somebody could talk to my cousin.
Yeah.
Would that have been a good time to say, well, would you like to talk more about what the particular argument was about?
Yeah.
Should we talk about that now, or should
Well, because I don't want to talk to her cousin, and so I don't want to know. In some ways, I don't want to open that door for them. That's a very good point. But you wanted to say something before I keep answering questions.
I just want to say something about what you were saying. If he started to ask me about how many members of your family has been deported, I'm going to become a little bit like, I don't know. I mean, I just met this man.
I just met this guy.
And even if he say that everything is confidential, I learned to not trust everybody because he can talk with the police probably, and he can tell them that I have no papers. Also, I am going to become a little bit upset what he wants to know.
Yeah.
And I know I'm going to tell him eventually when he builds that trust, and that is going to be with the time, probably the second time, probably the 10th time.
Yeah. Confianza is
Yeah.
the term. You know,
So
that
that's
she has to
why-
have confidence in me and trust in me. Both.
Yes.
Yeah.
I'm glad you said that too, because I think it really fits with what you were sharing before, which is that you had all these support groups, and you chose to turn away from them because you felt as though people were asking too much and everyone knew too much.
Mm-hmm.
And it fits in with how you were presenting yourself as, you know, I just need someone to listen, and listen to what I want to say, as opposed to here's all the drama of some of the people.
Mm-hmm.
So I appreciate you doing that. But I think that it is really hard to navigate. I did notice that difference when you switched to some of your Spanish phrases. And what's interesting, it also made me realize that the way you were wording the English, when you said unburden yourself.
Right.
You know,
That's a weird construction. Yes.
that's a different construction, and I suddenly realized when you said it in Spanish, I said, oh, that made a whole lot of sense. But I think that that is hard to navigate. You know, how do you phrase some of these questions so that you're relating? I was imagining myself reading some of these questions that you wrote, and I was thinking, God, if I said it, it would come out so clunky. And there's just this subtlety, especially when there's that language barrier, I think, to helping you understand.
Yeah.
That's why we're going to practice this.
Well, not only that, the questions are illustrative. They're not, you know, they're worked out. We work really hard to make them clear, sharp, simple. But you could use them. You could change them. She used a number of key. There was. It was very interesting to come to Wisconsin and meet somebody from Mexico and find the same words that I find in New York. You know, but the idea is that. I mean, I'm assuming you're from Mexico. I have no idea where you're from.
I am.
But you're playing somebody from Mexico. But there was a set of concepts that the unburdening herself is this. Ahogarse is a conflict. The issues with confianza are key issues of trust. The idea about the medicine, depending on them, being afraid to depend on them in order to function. Depender de ellas para poder funcionar. You know, is a phrase that I've heard a million times. It's a slightly different version than addiction. It's more like an overuse of a crutch, that over time your natural ability to sleep would become atrophied by dependence on medication in order to have normal sleep, as opposed to the idea that you would need to take the pill in greater amounts and you couldn't stop it. It's similar, but there's a variance on it that is usually quite important to note. And so there's certain things that are codes that I've heard a lot, and some were very obvious. That you did very well. By the way, you expanded on the suggestions, which were very good to begin with. But the expansion on the idea of how it affected the family in Mexico, how it split the entire family, how that how could he do that? The selfishness of the cousin in putting his interests, whatever it was, over and above the interests of the family, the lack of respect, the falta de respeto issue that I mentioned, the fault. It's not lack. It's a breach of respect. Basically, it's the concept. There was another one the whole idea about being offended. You played being offended very well. The idea that this was a line. You'd never go to the police. It's one of whatever it was. It doesn't have to be the police. There's a line that he breached, that it's very hard for her to recover from. He's offended the family. He's offended her parents. You don't walk back from offended so easily. So that kind of how am I going to speak to my cousin? That's the answer. I don't want to speak to the cousin because she in some ways has to breach the family thing, and I can help her. Now it's a good question. You guys are asking a really good question. It's a good question in the sense that would it come to the point where I would have to do that? But I don't know the family. I don't know the neighborhood. I don't know anything. Why am I putting myself? I would all of a sudden become the cousin's partner in some way. I'm her partner. It's a certain almost philosophy of therapy that it would be good to discuss. Yeah.
I tend to enlarge social networks.
Uh-huh.
I would tend to say, what would you like me to say to the cousin?
Yeah. Yeah, that would be great. Yeah, sure. Yeah, sure.
I would have followed
right then and there. I wouldn't have. Again, because, but who knows who's right, obviously. But I wouldn't have done it because I'm now asking too much about the cousin. It's like, what do I care about that? She would start. Would you have started thinking, why does he want to talk? Or would you want me to talk to your cousin so you do want me to find out, for example?
Yeah, probably I don't know either what the problem is, but I
Right.
want to find exactly what's going on.
You don't want me to find exactly what's going
What's
on.
going on, yeah.
Why not? Why don't you want?
Probably something embarrassing to me,
Uh-huh.
and probably, yeah. But also because I have been here for 20 years. I know the rules in this country, and I know service providers cannot talk most of the time with family members. You have to have a release of information. I mean, it's a whole process that doesn't happen in my country. And if I told my doctor, you need to talk with my daughter because she's misbehaving or something, then she say, bring her right away.
In Mexico.
Yeah, and she's going to
So-
tell
Stop doing that. Right, exactly.
Your mother. You have to respect your mother.
Right.
And the rules here are so different. And also you make a big deal of autonomy, and that means I have to do things by myself. And I work with women. I work with women here, and I have to talk them. I'm sorry, I cannot talk with your children because my agency doesn't allow that. But I can help you to find the right words to talk with them. I mean, honestly, I want to talk with the children. I want to do that, but I know the culture, the policies here doesn't allow me to do that. Probably he, in his role as a doctor, can do that, but it's going to be a procedure, and I don't know if I want to go through all those things.
Well, other possibility certainly is later, the possibility about doing family therapy.
Sure.
With the right person. And I have to say, I'm very glad to hear you talk about how you would talk to the children, because I have some children who I talk to just like that, and the mother and the interpreter seem to understand what I'm saying. You will listen to your mother. And because the hierarchy is very important. And even I had a child the other day who thought that she was going to come to see me, and I was going to disagree with her mother. And I said, oh,
No.
that is not happening. You know, the mother was saying, I want you to read books, and she was saying, she thought I was going to say it was okay for her to read them off the iPod. And I said, no, your mother and I are partners. And I thought, oh no, little 9-year-old daughter, your mother should never bring you back here if I say I disagree.
Mhm.
A different area that we haven't touched on. We brought up as one of the coping areas of one of the trust issues, the church and the priest.
Yeah.
And I wonder about asking just a little further question at point. So I can't go to the priest. I'm not feeling as comfortable going to church. Asking about, are there any other things you are doing in that area that help? Are you praying? Are
Yeah.
you saying the rosary?
Yeah.
Again, we're working with this issue of trust, which means don't ask too intrusively, and shame, don't expose something as a problem. But would you go further with that in